Oh, we are? Okay. Let me put this over here. Mm, mm. I'll be 37 come January. And I have so many memories, great memories, challenging memories that have been, I remember some challenges that I've had in my life as well. But I have to say that what really makes me feel filled and maybe even fulfilled is what I'm doing right now at 36 and a half or 36 and 3/4. I can trace back and look at all that I've done in my years, how ambitious, how inspired, how driven, how determined I have been since I was a little girl. And I think about how I always had this mentality of not being beat. You know, it's like almost treating life like a competition. And I really have excelled. I ended up getting a lot of things to show. Right now I'm in my doctoral program, obtaining my PhD, and I have a good business. I have my own private practice, group practice called Reset LLC. It stands for Restoring Every Soul Each Time. It's about resiliency, helping people to reset their lives and to be fulfilled and restored, actually. And I have my own home, I have my own car, have offices in different states, have quite a few licenses. But I can honestly say that right now, what really matters most to me and what I can really show forth for is being a caregiver. I really feel more fulfilled in being a caregiver. And that's not to knock all that I have accomplished, and I thank God for what I have accomplished. But right now, it's about being a caregiver. I have 4 memories in talking about Mary. I have a memory at 13, at 18, at my early 20s, and my mid 30s. Mary and I, at 13, we didn't get along at all. I didn't like her. She didn't like me. I couldn't stand her. She couldn't stand me. Oh my goodness. 2 females in a house with a bunch of males. And we had to learn how to get along somehow. But see, I was very hard-headed, I just wanted to do my own thing. I was never domesticated. I didn't want to stay at home, and her teaching me how to cook and clean, that wasn't my thing. My brothers stayed at home. They were more homebodies than I was. And we always bumped heads all the time. And I just used to think to myself, I said, wow, how will we ever get along? Why is it that we can't get along? These 2 females in this house, in the midst of all these guys in the house, we need to get along somehow. I won't ever forgive her when she had, oh my God, I was very disobedient, and where we lived was really bad, a bad area, and I was being hard-headed. We lived on one end of the street, and my friends lived on the other end of the street, and I used to stay up on that end of the street, but that's where the drug dealers were, that's where the violence were, and I didn't care. I wanted to be up there because my friends were there. She told me not to be up there, and then something went down where there was a shooting. So easily everybody was able to get in the house because they were all up there. That's where the shooting happened. I had to run all the way to the other end of the block where I lived, and I got in. You know, my brothers opened the door, and as she was coming down the steps in her nightgown, her little self, I'm thinking that she was like so happy that I made it in safely and from harm's way. I thought she was going to embrace me, and sure enough, she embraced me with her fist. She knocked me out. Oh boy, I hope nobody reports her. I can laugh now. I really wasn't laughing then. My brothers weren't laughing, they were crying. Yeah, we all cried. Oh my God, yeah, 13, But it wasn't until I was 18 and when I went to school, and I was happy to be away. I was so happy to be away. I finally was able to launch out and do my own thing. And it was very lonely though, being in college, starting off. I didn't feel like I fit in. I didn't feel like I had any friends, especially from when I was younger and transitioning to being a young adult. You know, I was considered the nerd growing up and a teacher's pet, and, you know, always had A's and accolades and awards. And then I just felt like, okay, I just didn't fit in. And one day I was actually very, very sick. And I remember they used to call me a lot. My parents would call me a lot. I didn't really call them because, again, I was happy to be away. But again, feeling lonely, I didn't want to call them and tell them about how I was feeling. But one day I was feeling really sick and I was by myself. I didn't have anyone there on campus with me. And I remember my mom, Mary, which is my mom, she had got on the phone and she heard my voice and she was like, oh my God, my baby, I need to get to her. And she had told my dad, she's like, look, Charles, we got to go get her. She's not feeling well. He was like, I really don't have time to go down there. I got other things to do. And she's like, look, forget you. I'm going to come down there and get my baby. And sure enough, she caught 2 buses, 2 trains, and walked like a good couple miles to get to my dorm room. I heard her knocking on the door, and I was like wondering who it was, and I was just a mess. I was so sick. And I just remember with a sheepish voice, I was like, who is it? And she was like, it's me, it's your mom. And I was like, Mommy. And I was just so happy. I couldn't believe that she did that for me. And I don't know why. I mean, she's my mother, but because of how our relationship was as a teenager and the fact that she came, I really appreciated that. I never forgot that. And I remember when in 2007, I remember when my brothers had called me. I wasn't staying in Philly, and they were telling me, they was like, Mom is seemingly senile right now. She's not being herself, and she seems like she's forgetting things. And I'm like, well, did anybody take her to the doctor to see what's going on? I don't see that. She's still young. I don't see her anything wrong. We all forget things. We have a lot on our mind. And it's like, no, she's just being senile. And I said, well, look, we need to take her to the doctor. And we made arrangements to take her. And then the doctor had stated that she was at early stages of dementia. And it was very, very devastating because we never seen that happening. We never seen that coming. It's like, dementia, what is that? And I remember actually backtracking when I was 9. I used to go to my parents' room. Every morning I would usually be up very early and go into their room, and I would watch their stomachs to see if they're breathing. I always wanted to check and see if they were alive. And I used to think to myself, I was like, I wonder what life would be like when they're no longer here, or when they get old. I have plenty of brothers, and I'm sure that it's all good. We all get along. We all, we're family. I'm sure we're gonna work together to take care of our parents when they get old. When it came down to my mom having dementia, it was rather devastating, and we didn't know what to do. We all had our own opinions and view of if mom really had dementia. Maybe the doctor made a mistake. Let's get a second opinion. Maybe she'll snap out of this. And that wasn't the case. It really affected us and really impacted us in all types of ways. And I really will say that it was from 2007 to now that seeing my mom, I've gained more respect more appreciation, a more love. That when I got to see that despite of this disease that she ended up having, that her faith grew, her strength grew in God, her stance in just trusting in the Lord. I was just thoroughly amazed because I can honestly say that I became very angry with God. I didn't understand why he allowed this out of everybody in our family. You know, a couple of people I could have said or could have, said, hey, maybe that person should have got it. But for our keystone, or the pillar in our family, the matriarch, my mom, I was able to see such a resilience in her, to the point that I gladly took on this role, made arrangements to not work or to directly see clients, and hire staff to run the offices so that I can be with my mom. And long story short, her staying with me, it had many triumphs and many trials, many challenges, many hurts, many pains, but many blessings and many great things out of it. And I'm not here to glamorize, I'm not here to romanticize being a caregiver. It's just really trying to be open and raw about how I realized that being a licensed clinical psychotherapist, being in one position of counseling people who are going through being a caregiver and encouraging them about utilizing resources and avenues and ways to get the help and assistance that they need in taking care of their loved one. It was such a rude awakening being on the other side as the caregiver and seeing how challenging it is in getting services and care. As a caregiver, I realized that we're not ones to ask for help necessarily, or consider it as being a bother or troubling people with our problems. We look at it as, all right, this is our loved one, we need to take care of them. But I realized how tiresome and exhausting it can be, and not having the financial assistance, not having the physical assistance, not having the emotional stability and the assistance. As caregivers, the need is there to really get support. And there are many support groups out there. There's quite a few resources that's available to caregivers in support of their loved one. But I got to see that there seemingly is a gap in direct services for the caregiver. And I was so compelled to want to help other caregivers, because I can only imagine being a caregiver, but being in the mental health industry and seeing how hard it was to having to go over hoops, having to do a lot of research, having to really press and be determined to get whatever services that you need. I was fortunate and blessed to be in a position to have home health aides and to pay out of pocket for them. Although it did pose challenging, especially because I have a business where I have to pay for my staff, pay for now the home health aides, pay for medical services, whether medications that Medicare doesn't cover, whatever that my mom needed that financially her Social Security and her pension may not cover. It's not enough. It did pose challenging for me, financially, emotionally, mentally, physically. I've seen the changes with myself where I didn't want to see the actuality of it. I've seen how stressed I became, losing weight, losing my hair breaking off, not wanting to eat, being depressed, being sad. And for someone who has been so jovial and very upbeat and happy, and to see the changes over my life because of this. And I didn't want to feel like I was blaming my mom for her getting this disease, because she sure enough didn't ask for it. But at the same time, I guess I started to feel guilty for feeling the way that I was feeling. And because I looked at it as, all right, look, my mom first and then me, making sure that she's fed, making sure that she's clothed, making sure that she has a roof over her head. And just by default of how the family dynamic is, I've always been the one that was the go-getter. I was always the one that would do things, make things happen. So I knew how challenging it was for my dad, especially for my dad, to see his wife of over 50 years decline the way that she has, or my brothers who have seen mom as being mom and now seeing her in her vulnerable state. And it just really got to the point that it immobilized many of us in our family, having us to become at odds with one another, and not really, in all honesty, just really not knowing what to do, really being hurt and devastated. So I just looked at it as someone had to do something, and I didn't have time to lick my wounds. I didn't have time to be angry and be emotional about it. She needs help. She needs care. But it is a tall order. This selfless act of love or service to your loved one as a caregiver, it can be a blessing and a curse, but it's about balance as well. And that's why I'm doing this, because I want to make sure that the very least I can do is to bring awareness and attention to the need, the growing need. Because as caregivers, this is a circle of life. Someone's going to take care of someone. Like I said, at 9, I didn't see this coming. I saw my brothers and I rallying together and helping one another take care of our loved one. But because of how it has impacted us and how in our own way we try to do our best to take care of our mom, where the brunt of it really falls on my shoulders, but that was by my choice. But nevertheless, it still can be taxing. And when I look at the studies, again, being in school, I did a study on Alzheimer's care and caregiver support, and just looking at how 1 in 8 Americans, 1 in 8 people have Alzheimer's disease in the United States, according to the Alzheimer's Association study. And also looking at how over 14 million people are considered as caregivers just for dementia alone, taking care of loved ones who have dementia and Alzheimer's. So let alone you're going to have even more caregivers who's taking care of loved ones with other various diseases and illnesses. And the statistics are out there in terms of you have so many caregivers that's out there that's doing such a service of love, but it's unpaid. And realistically, we all have to make ends meet. We still have to live. I remember having to do my study for school, and I ran across a grant that pays for respite services and respite care for the caregiver. And it's very few and far between in terms of the guidelines and even the amount that they will pay for some type of rest or respite service for the caregiver. And I'm like, you know what, it has to be more, especially because it's going to be a growing number of caregivers, not just in America, but throughout the world. With the baby boomers at the age that they are and the stage of life that they're in, there's going to be a growing need of taking care of the baby boomers, but also being the age that we are, whether being in your early 20s or being in your late 40s or early 50s, and taking care of a older loved one with a debilitating illness. It can pose challenging. As a matter of fact, studies also show that between 40 and 70%, the mortality rate of caregivers losing their lives because of stress and other things that's impacting their life in caring for a loved one in comparison to those who are not taking care of a loved one. Those are high numbers, and all in the name of taking care of someone that you love. So because of the field that I'm in, the heart of advocacy that I have, and because of my mom, you know, she had instilled in me. I watched her over my years and seen she has been such an example of strength, of faith, of wisdom, of integrity, of meekness, of pride, she's just been such an amazing woman, taking on so many jobs, doing so many things, even supporting herself through school while supporting her kids through school, having to work hard after 19 years in being in school, but she finally got her associate's degree in elementary ed, and being a teacher's assistant. She was a Bayada nurse. She was a model. She worked at Sears. She did so much stuff while raising her children and taking care of her husband. I said, the very least I can do is give this back to her. But now to take it up another level and to try to see if this can be of any of assistance and support by sharing my story and also bringing awareness and attention to the need for caregivers getting assistance and support. So I had created Mary's Mighty Miracles. It's a nonprofit organization. It's in the works of being a nonprofit, or being tax exempt rather, so that it can bring four things: advocacy, awareness, education, and direct assistance and services. And in terms of advocacy, I wanted to be a voice. I wanted to raise my voice to the attention of not only just other caregivers, to let them know that they're not alone. We are not alone. Because sometimes I know that we feel that we are alone, even with having a big family, and you feel like, wow, you know, you have a lot of people, or you may just be one person, only child, definitely feeling alone by yourself, having to take care of your loved one. I wanted to raise awareness about the need of caregiver support. Again, you have many organizations that are out there that provide assistance in terms of support, or by doing support groups. You have advocacy, such as bringing attention to legislature and to community leaders about what's needed in the community regarding support with any type of illnesses, like with cancer, with again, with Alzheimer's, with dementia, with whatever's out there. You do have a lot of those support groups, but it's another thing to now actually directly support the caregiver financially, providing counseling support services for the caregiver, financial assistance, whether having stipends that can help when people have to stay at home, or when they can't stay at home and they need a qualified, trained health professional to care for their loved one. So just really trying to see how we can bring the attention to this need, as opposed to being reactive and waiting until it blows up in our faces. And now we're trying to see how can we manage this growing need and concern. I would hope that we can be proactive in this being twofold: advocating for the caregivers who are currently caregivers, but also paving the way for future caregivers, so that it will be less strenuous, it will be less taxing, and that more support and needed services will be there and available for you. Education, in terms of trying to help us to know how to better attend to our loved one with a debilitating illness. So whether to know how to take care of a loved one, let's say with someone who has dementia or Alzheimer's disease, and knowing how the trend and how the stages that you're going to see your loved one go through, having a better understanding and knowing how to meet that need while your loved one is declining. I think more education and awareness on that is needed. And also in terms of training and making sure that people are really qualified in attending to our loved one, whether they're certified in home nursing and home care, if you're trying to have your loved one to stay at home, and So not only just having caregivers learning how to take care of their loved one, but also making sure that when we do have to reach out to home health agencies and services, that they really have qualified, trained professionals who knows how to really attend to your loved one the way that you would, as a caregiver, would want your loved one to be attended to. Definitely financial assistance. That's the next point that Mary's Mighty Miracles desires to create a platform where financial support and assistance is available. Again, whether that means having more grants, having more stipends that can provide rest and care and support to the caregiver while they're caring for someone. And definitely self-care. While the desire with Mary's Mighty Miracles is to really push the caregiver to be persistent, to be proactive, to be really determined in pushing for care and support and services that are out there. Also trying to make sure that there's balance, that you also have a life. I know with Mary, with my mom, I know that she wouldn't want me, if everything was fine, if everything was equal, if everything was just well, she wouldn't want me giving up and sacrificing my life for her, because she would tell me that she already lived her life and she would want me to live mine. And at one point I was actually not regretful, but resentful, feeling like, wow, I have my whole life to live. She lived her life. Why is it that I feel like I have to give her my life for her to live? So I'm carrying two lives in one. But then I had to change my perspective. I looked at it as, okay, I'm choosing to do this, but that means that I just have to have balance. And like I mentioned before, it's not that caregivers aren't trying to have any type of support or assistance. It's not like we want to stay at home with our loved one and let that be our life. It's just a matter of we want to make sure that we can trust that we have the appropriate services and care for our loved one so that we can be at ease and to not be stressed about it. Like the actual services are there and available and consistent and quality. It's really quality work or service that are given to make sure that, all right, we don't have to stress, we don't have to worry, our loved one is attended to and taken care of. So we can go about our lives and live it out to the fullest. So I wanted to make sure that through my story, through Mary's Mighty Miracles, that it opens up the door. It's a platform for the current caregivers, again, in knowing that you're not alone, and also to pave the way for the future caregivers, to make it easier for you to care for your loved one, but to also be able to have a balanced life and to live your life to the fullest, even while being a caregiver. It is absolutely possible, and it's just a matter of having the right supports in place and the services available for you in mentally, physically, emotionally, and financially. So I know that my mom will be very proud. I know that she's already proud of me. I've been amazed that even with now her being in her end stages or the latter stages of Alzheimer's disease at this point, she's still a mom. She's still my mom. You know, I don't look at her as her being my child. I still see me being hers, and she definitely still sees me as being hers. And I am so blessed and fortunate that she still knows me. She still recognizes me. She still recognizes her husband and her sons. She still knows her name. She can still say her name. I appreciate the littlest things now. I was praying one time and it came to my mind that the Lord brought it to my remembrance about dependency and submission and trust. And I see that that's where my mom is with God, but that's how she is with me. She's depending on me. She's trusting me. And wow, I'm like, wow, I didn't look at it like that. You know, like she really, her life is in my hands. And so it's too precious of a thing to mess up, to drop, to not speak about this need. I want to make sure that I give my mom the very best, because she certainly have given me the very best. She certainly have given her all to the best that she could for all of us. So the very least I can do is not only do this on behalf or in honor of my mom, but to make sure that the platform is very available and ready for other caregivers, current and future. So if you want to learn more about Mary's Mighty Miracles, please go to www.marysmightymiracles, all one word, .org. marysmightymiracles.org. Or you can call us at 855-GO-MARYS. 855-GO-MARYS. And I hope that this will also open the door for other caregivers to speak out about the needed attention, public attention, awareness, and trying to make sure that while we are doing this kind, selfless act of kindness and love and service, that better support, better services are incorporated to make it easier on the caregiver in caring for their loved one. And that's what Mary's Mighty Miracles is all about. It's caring for those who care. So we don't have to feel guilty anymore, and we don't have to worry about talking about, well, we can't worry about ourselves. We know we have to put ourselves on the back burner for the sake of our loved one. I remember having a meeting, and one of our members said that she felt like she felt guilty, or she felt as if she was wrong for even considering herself, but she felt that no one else was considering her as a caregiver or as a person. She have all these needs, and there's a life that she wants to live. I've heard many stories from many caregivers talking about how they had to give up their lives, and they had to make sure that everything was in place for their loved one. And then they had friends who would say, hey, you should get out more, you should do this, you should do that. It's not like we don't want to. It's just a matter of making sure that the services and supports are there for the balance, for the self-care, so that we can actually have a balanced life and have self-care, so we can be less stressed and more, and just more at peace and more fulfilled and more happy. So I thank God for my mom. I thank God for my family. I thank God for Mary's Mighty Miracles. I thank God for God. And I thank God for this opportunity to just be at least a starting voice and an advocate for the caregiver.